Okay, Assalamu alaikum and good afternoon from Malaysia. I think it's time we should start. Thank you very much for joining this 15th webinar of MedEd series. And the webinars we have been presenting so far can be sort of classified into two groups. The first is that first group of webinars actually address the day-to-day activities or on ground problems, like we had sessions on the study guides, our PBL packages, or the delivering integrated lecture. Whereas the other group mainly deals with the concepts, like we had programmatic assessment or competency-based education or lecture-free curriculum. This presentation today, or this webinar today, relates to the second group, which is towards the concepts. Introducing these concepts and talking about this is meant to produce well-qualified and skilled doctors and not just medical graduates. So let's start with a case scenario or our case study. And the first one, the patients who need further care from other health professionals are often referred by a letter or a phone call. This case study is in fact a problem presentation or identification of problem, we can call it. So patients who need further care from other professions like speech therapist or physiotherapist are referred by a letter or phone call. However, there is little dialogue between various professionals to discuss the best management strategy for that individual patient. Although these patients receive these services from multiple health professionals, these services are essentially fragmented, and they kind of present a multidisciplinary approach, but it's away from interprofessional education. So problem statement here is that the services provided are essentially fragmented in our medical profession under the present situations, and we want to address that. The second case study is a slightly better situation, and this is my own personal experience. The integration of pharmacists within the medical teams. Actually, it's about 20 years ago it started here in Malaysia that pharmacists were joining our ward rounds. So they were integrated in the medical team, and their role has gone beyond dispensing medicine now. They provide medication counseling for patients, as well as they support doctors with detailed drug information. Since 2007, the pharmacists run what they call is medication therapy and adherence clinics in various specialized areas, such as diabetes, asthma, renal disease, anticoagulant therapy, methadone replacement, basically chronic conditions. And these clinics are managed by the pharmacist, and they are set up to optimize the patient's adherence to their medication, that is, to achieve a better compliance and therefore a better outcome. The third case study relates to interprofessional practice, where we use the combined clinics. For example, in the cochlear implant clinic, the otologist, audiologist, and speech or language pathologist are seeing patients in a single visit and a centralized setting. The point here important is a single visit. The patient does not need to come again and again to see different specialists. On a particular day, all the specialists are present in the clinic, and patient can be seen by all these specialists, and they can discuss with each other and improve the treatment. Some specialized diabetic clinics in Malaysia are jointly run by endocrinologists, dietitians, and nurse educators. So these are examples of interprofessional practice. The fourth case study, I have quoted our own member of MedEd series, Dr. Rafia Minhas. She wrote in one of the discussions that if medical students are studying with physiotherapy students, the medical students think themselves to be superior than the physiotherapy students, and initially look down upon them. However, when they learn together in a combined class, they gradually learn to work together and develop respect for each other. Interprofessional education helps develop tolerance, but we are not satisfied with tolerance only. We are looking for acceptance and teamwork in health profession. So what we would say that interprofessional education helps develop acceptance and teamwork in the health professions. Some examples from the work. I thought nurse is my subordinate and she must follow each and everything I say. Of course, a wrong perception. I shouted on laboratory technician, I want the report now. I didn't know how long it takes to process the specimen. Physician decided that the radiographer must perform the procedure on this patient, whereas radiographer was not consulted for that situation. Laboratory sent back the specimen with the comment, it's not labeled properly. Person said, I was so angry. Pharmacy called me, the dose of anti-epileptic drug is too high. A pharmacist wrote me a note, do your duty carefully. Actually, this was one incident which happened with me personally, and this was a prescription for a patient with neonatal tetanus where high doses of diazepam were prescribed, and the pharmacist was really wondering why such a high dose of diazepam is being given to a neonate. So, improving quality of healthcare, the quality of service delivery in health and social care depends upon an effective workforce practicing collaboratively. The important word here is effective workforce practicing collaboratively, and interprofessional education can bring about the changes needed for the development of such workforce. Quality education that enables interprofessional learning in classroom and practice context. There are two situations, classroom and practice context, is the key to efficient and effective workforce development. And that is what IPE is aiming for. So coming to a point of learning together to work together. And this brings us to our today's topic of interprofessional education, concept and implementation. The learning outcomes for today's session, the participants would be able to explain the concept of interprofessional education and interprofessional practice, describe the different models of interprofessional education being implemented internationally, develop interprofessional education curriculum for undergraduate medical students, and plan and implement interprofessional education curriculum for undergraduate medical students. To introduce the interprofessional education concept, there are three statements which can explain the whole concept very nicely. Number one, interprofessional education occurs when students from two or more professions learn about each other, from each other, and together to enable effective collaboration and improve health outcomes. The three words here, about each other, from each other, and with each other, means together. These three words make the basis of interprofessional education. The students learn about each other, they learn from each other, and they learn together. When they learn about each other, they are introduced to the different professions, their responsibilities, their mindset. The second statement, the goal of interprofessional education is to prepare health professionals with the knowledge, skills, and attitude necessary for interprofessional practice. Interprofessional practice results in the collaborative and comprehensive care that patients value and expect. It is the result of interprofessional teamwork. So these three statements make the real basis and give the real concept of interprofessional education. Interprofessional education is an educational continuum. The uni-professional education, this is what we are practicing largely nowadays. Students are all from the same discipline or profession. The mastery of a specific body of knowledge, types of skills, and modes of conduct are emphasized. Sorry, a bit technical. Can you see the screen?
Yes, sir.
Yeah. Were you able to see the previous slides?
No, sir.
Oh, I'm sorry. There was some problem there. So anyway, I'll start from here. The learning outcomes. I'm sorry. The first few slides I thought you are able to see, but they were not seen. I think I'll just go through them very quickly. And learning outcomes. Before that, it was okay.
Learning outcomes was fine. You could see it. After learning outcomes, you could not see it.
Oh, I see. I thought you were not able to see from the very beginning. Okay, now so learning outcome was okay. The next was the three statements. And I have tried to explain that the interprofessional education occurs when students from two or more professions learn about each other, from each other, and with each other. So these three important words in the concept of interprofessional education. And the goal of IPE is to prepare health professionals with the knowledge, skills, and attitude necessary for interprofessional practice. So ultimate goal is interprofessional practice. And the third point was that interprofessional practice results in the collaborative and comprehensive care that patients value and expect. It's a result of interprofessional teamwork. The IPE is an educational continuum, and the first one was the uni-professional education, which presently we all of us are almost practicing, where students from the same or one professions, they are taught in isolation, and the mastery of a specific body of knowledge, types, and skills is transferred. The second is multi-professional education. Here example is, for example, anatomy of head and neck is taught in one lecture to both medical and dental students. So this is a multi-professional education. The students are from different disciplines. They are sitting in one class, just attending the class and leaving after attending the class. There is no learning from each other. There's no learning about each other, and there is no learning together. IPE or interprofessional education is not a shared learning where students from different professions learn together in a classroom sitting. That's not IPE. We may call it multi-professional, but it's not interprofessional education. Shared listening alone does not lead to IP learning. Shared teaching, students from different professions sitting side by side in a lecture is not an IPE. IPE is a planned learning that takes place when students from different disciplines work together. So basically, it is a workplace learning. It's not necessary working in one ward or one situation. It can be working as a team on different projects. Interprofessional education, students from various professions learn together as a team. Their collaborative interaction is characterized by integration and modification of different professions. That is very important word here. In interprofessional education, the contributing disciplines, they modify their content to suit the other professions which are joining the session. So it is modification in the content by the professions which are involved, and that leads to behavioral change of the students. Participants understand the core principles and concepts of each contributing discipline and are familiar with the basic language and mindsets of the various disciplines. So interprofessional education, modification of the usual content to suit other professions and leading to change in the behavior of the participants. These are two important components of interprofessional education. So that's how it is different than multi-professional education. Why we need interprofessional education? At present, most university-based health professions focus on uniprofessional. And it has been shown that uniprofessional education limits the ability of graduates with the knowledge, skills, or attitude needed for interprofessional collaboration. So uniprofessional education, which we are practicing now in most of the institution, actually does not favor interprofessional collaboration. Interprofessional teams enhance the quality of patient care, lower costs, decrease patients' length of stay, and reduce medical errors. Several studies have shown that the positive effect of interprofessional education on patient care and safety. So the health care improves if we follow interprofessional education. And the reason is that knowledge of what other professions can offer for your patient in certain situations, for example, welfare department or speech therapist or optometrist, that would improve the patient care. It has been stated that IPE has, the training in IPE has reduced the gap from the laboratory to patient bedside medicine. So that enhances the health care of the patients in the hospitals. Protocols and team-based care is required to manage chronic and complex diseases, such as cerebral palsy. So we always teach that multidisciplinary approach is needed for the management of cerebral palsy, but we should know what is multidisciplinary approach and what is the role of each specialty in this situation. In IPE, students learn together, build friendships, and cultivate professional relationships that will prepare them to eventually work better in collaborative care teams. These are different disciplines which work for the betterment of a patient, and they would work better, a lot better, if they also learn and practice together, and that is what IPE works for. IPE at international level, mostly the developed countries have adopted it, and usually at the undergraduate level, although some postgraduate level programs have also been initiated. In the UK, the number of government policies have advocated the use of IPE. In Canada, the IPE for collaborative patient-centered practice was initiated in the beginning of this century. The intention of IPE is interprofessional practice. So if we train our students using interprofessional education, we hope to achieve interprofessional practice. Some of the examples, like cochlear implant example I have given, the specialized diabetic clinics are cerebral palsy clinic, where pediatrician, physiotherapy, ophthalmology, rhinolaryngology, orthopedics, social workers, psychology, they all work together. These interprofessional practice clinics, they, as I mentioned in the example of cochlear implant, same thing in the cerebral palsy clinics, where all these specialists are people from different professions. They are present on one particular day in the clinic, and patient has to visit only once rather than going to every specialist separately. It not only helps the patient, but also it coordinates the practice and provide better care to the patient, because all the specialists can discuss the situation on the spot. The aims of interprofessional education, the important first one, preparing a collaborative practice-ready health workforce. Collaborative practice-ready health force. Health worker is someone who has learned how to work in an interprofessional team and is competent to do so, understands and respects the roles and expertise of health and social care professionals in the context of working and learning as a multi-professional team, understands the contribution that effective interprofessional team working makes to the delivery of safe and high quality care. So this is kind of healthcare providers needed to be produced, and that is the aim of interprofessional education. Now, talking about allied healthcare professionals, their requirement following the IPE has been listed in AMI Guide number 62. Number one, the work in partnership with other professionals, the support staff, service users, their relatives and carers. They contribute effectively to the work undertaken as a part of multidisciplinary team, demonstrate effective and appropriate skills in communicating information, whether it is advice or instructions or professional opinions, and understand the need for effective communication throughout the care of service users. So following the concept of interprofessional education, these are sort of learning outcomes outlined for allied healthcare professionals. What are the competencies which IPE is aiming for? First, there are some generic competencies which are common to all professions, like interprofessional team and team-based practice, values and ethics for interprofessional practice, roles and responsibilities for collaborative practice, and interprofessional communication practices. So these are the competencies which are common to almost all the professions who are providing healthcare. So these are generic kind of competencies, and they are the minimum what an IPE can achieve. Examples of this are in pre-qualification stage. In terms of attitude, appreciate the value of interprofessional collaboration, acknowledge other professions' views and ideas under the attitude. If these are our learning outcomes in a pre-qualification stage, we expect that in post-qualification situation, the health professionals will show the readiness to exchange viewpoints and information, and they would be willing to share or relinquish their responsibility based on the situation. If we take the example of skills, in pre-qualification stage, the learning outcome is to communicate with learners from other professions, and post-qualification expectation is that they would collaborate and negotiate effectively with other professionals and agencies. So this is an example where the learning outcomes in pre-qualification stage are translated into post-qualification stage to improve the interprofessional practice and provide better healthcare to the patients. There are different levels of IPE outcomes as described in the BME guide. Level 1 is the initial views, learners' views on the learning experience and the interprofessional nature. At second level, there is some modification in the perception. So the initial views start to change a bit in terms of perceptions and attitude. At next level, the acquisition of knowledge and skills linked to interprofessional collaboration, leading to behavioral change. Identify individuals' transfer of interprofessional learning to their practice. Behavioral change in the sense that whatever it has been learned is now being practiced in the real life. And then from person or individual, it moves to organizational practice, change in organizational practice, and final would be the real benefits to the patient and the clinics. So starting from individual views, moving to modification, improving learning, change in behavior, ultimately going to change the organizational practice and benefits to the patients. So we can have, we can look at our IPE program and see at what level we are achieving and what we should be achieving towards the end of the day. And that is obviously the benefits to the patients. That's why in the beginning I was explaining that the purpose of these concept based sessions is to produce skillful and well qualified doctors and not just medical graduates. The scope or spectrum of interprofessional education, there are three categories. One is formal, that means which is really a planned program of interprofessional education. The informal one, where it occurs in the process of another planned activity, so it's not really meant to, but it's kind of the additional benefit. And third is by chance, that there is an ad hoc encounters between different professionals providing opportunity. The reason I'm mentioning these three is formal, informal, and by chance, that sometimes we may say that we are already doing it, but that may be simply informal or by chance and not really properly formal exercise. So what we are emphasizing here is the formal nature of interprofessional education, not informal and not by chance. What professions can be involved or what has been involved? I can quote some examples from the international situation. In UK, under the New Generation Project, 11 healthcare professions have been involved in interprofessional education, of course, in different combinations. Here, like in audiology, medicine, midwifery, nursing, etc., etc. So these 11 health providers or 11 healthcare professionals have been involved in different combinations in interprofessional education in UK under this project of New Generation. In National University of Singapore, the four healthcare professions like nursing, medicine, pharmacy, and dentistry have been involved in interprofessional education, of course, in different combinations. In National University of Malaysia, they have changed their learning outcomes to include the IPE in their undergraduate program. If you look at the outcome number 3, ability to work collaboratively with a multi-professional team with integrity and enthusiasm, and to assume a leadership role when appropriate. Learning outcome 4, ability to lead and collaborate with other health professionals in health promotion and disease prevention. So National University of Malaysia has included interprofessional education aspects in their undergraduate program and adjusted their learning outcomes accordingly. Another university in Malaysia, Management and Science University, is implementing this interprofessional education among number of programs listed here. An international conference on interprofessional education was conducted in Management and Science University in September 2019, and another international conference is going to be conducted in August this year. So it shows the importance of this aspect of training undergraduate students and its importance at the national and international level. Next question could be that how long should be the interprofessional education in a program? IPE should not be seen as an one-off initiative. Just 1 or 2 sessions would not be enough for practitioners to work collaboratively throughout their careers. We should start interprofessional education at the right level, neither undervaluing or overestimating participants prior to knowledge and experience. So means that bringing the different professions together in one learning place should be chosen carefully and at the right level. To foster effective interprofessional practice, continuity of IPE throughout the professional training and education period and beyond is necessary. Here is an example from King Abdulaziz University, Saudi Arabia, where the IPE is starting at the year 2 between nursing and medical students and goes till the final year. How to develop interprofessional education curriculum is the next aspect. And the first step is, of course, to bring the learning outcomes of the participating professions and see what are common among all and what are unique. Common to all would, the easiest would be the one I showed you earlier, the basic concepts of communication, collaboration, and teamwork. But we want to go beyond that, and here is another example. For example, discussing a patient with injuries to face between surgeons involving dental surgeons as well. The example of unique to each can be, for example, the physiotherapy, where there are very specific skills required for that. So when we are developing the curriculum, we have to see and try to get the common aspects first, so that each discipline can benefit from those common learning outcomes. The principles: developing a curriculum that effectively meets the learning needs of members of different professions. Of course, the curriculum must fulfill the requirement of the participating professions. Most effective use of staff time and expertise. Three main questions which need to be answered. What should be the content? What should be the teaching learning processes and methods, and how to assess? What should be the assessment methods and what should be the frequency? So whenever we are developing a curriculum for interprofessional education, we need to answer these questions. Another important aspect would be recruitment and training of facilitators, and that should be mandatory because the IPE needs some experience, some skills, and some change in the mindset. The curriculum development team, of course, would include the departments which are going to be involved, and can be 2 or more. Again, the question need to be answered: who needs to be involved in the development of process? When are they needed, and how will they be kept up to date with progress? So the team may need to issue brief management bulletins at key stages. And now the facility is that not all the meetings need to be face-to-face. These meetings can be conducted online as well. Assessment is another important aspect of planning and implementing interprofessional education. So approach to the design of assessment is to answer the following questions. What aspect of learning from interprofessional experience do we wish to assess? What assessment tools are appropriate for the learning outcomes? And is there any constructive alignment between the learning outcomes, the learning process, and assessment process? Of course, that is the most important aspect, that the learning outcomes must be aligned with the learning process. The assessment methods which can be used is the project report, maybe community project or mini projects within the institution. Completion of shared task, for example, planning and executing a vaccination drive in a community. So it means that the students from different professions can come together, they can plan how to go about it, or they can actually be part of the team who is executing this activity in the community. Supervisors' comments peer assessment, portfolio, and self-assessment could be the other assessment methods that can be used in interprofessional education. Some other assessment and feedback methods, for example, the verbal feedback on their IP learning experiences by the students, written assignments that describe and evaluate the process of working together in an interprofessional team, poster presentations where all the participating students from different professions can prepare a presentation and showing the salient aspects of their interprofessional experiences. And multidisciplinary team treatment care plans. So the students work together on a plan or a situation where they have to discuss the treatment plan of a particular patient, and where different professions are contributing to the management of that patient. Once we have developed the curriculum and we have developed the content and the assessment, and then how we are going to implement it, the opportunities for implementing interprofessional education. Inpatient medical and surgical ward rounds means the other professions, their students can come and join these ward rounds. Inpatient nursing rounds, handover, takeover sessions. Medical students can go and join dental clinics, for example, pharmacy practical sessions, laboratory technician practical sessions, speech therapy sessions, physiotherapy sessions. So apart from these sessions, if there is a teaching session or discussion sessions that should incorporate perspectives of other professions in that session. So these are different opportunities where interprofessional education can be implemented. The National University of Singapore has created what they call is interprofessional enrichment activities. These are opportunities. They are optional. They're optional for the participants, and those who attend these optional activities are given a recognition certificate which can help them for further studies or scholarships. This is the model which is being used at National University of Singapore, and if you see in the center there is a core curricula which is mandatory for all the professions being involved. And then there is this outer circle is the activities or the IP enrichment activities, which are optional, but those who attend this, they get an additional certificate which is helpful to them. And it is not only for students, but the staff who help in creating these activities are awarded as well. The core principles of interprofessional education, what is called the 3Ds, the dialogue, discussion, and debate. Of course, the nature of IP is such that this would generate dialogue, discussion, and debate, and where the learning, the mutual learning would take place. High quality of interaction is important. Learner motivation, group balance, informal learning, and learner assistance. The group balance is important here, so that the group is constituted carefully so that there is no dominance of one group over the other. The rules of conduct of interprofessional education session, every member is important and equal. Every member has his or her own strengths. Diversity in opinion and experience is a strength. Every member has a right to disagree. Every member is there to learn, are open to learn. They learn from each other, they learn about each other, and they learn with each other. Every member must participate actively, and every member is equally responsible for the success of the learning session. Here are some examples of type of interactive learning for interprofessional education. The first one is the exchange-based, which includes debate, seminar, workshop discussions, etc. Observation-based, there's a work shadowing, or what we call houseman shadowing. Action-based, where there is a collaborative inquiry. Problem-based learning sessions, joint research can be included in this group. And simulation-based includes role plays and experiential group work. So these are different types of interactive sessions which can help in the implementation of interprofessional education. Methods of IPE implementation. The problem-based learning is probably the most easiest and useful, where students from different professions can be brought together, like medical, pharmacy, and nursing students. Of course, the scenarios and the triggers for these PBL sessions need to be constructed accordingly, keeping in mind the learning outcomes of all the professions which are participating in these sessions. Project-based learning is another, where projects within the campus or outside campus can provide good opportunities for students from different professions working together and learning from each other. Team-based learning sessions, again, students from different professions may be brought together in a TBL session. Then, of course, the content and the learning outcome must cater for all the professions from where the students are coming. Implementation methods in National University of Malaysia, they have two specific modules. One is comprehensive healthcare module, where the IP concepts are explicitly introduced, and this is a co-curriculum module. Working together as a healthcare team is another module. They are also using interprofessional problem-based learning, case-based learning, role plays, and online discussions, reflection sessions, and workshop with hands-on activity. So these are different methods being used by this particular university. IPE in different situations. This is an example in an acute clinical placement, which is being implemented in UK, where medical and nursing students are involved. IPE in a Canadian community placement. So the first one is the acute clinical placement. Second example is in the community. This is being practiced in Canada. In simulated environment is another where I think these different methods can complement each other. And there's also an example of residential IPE, where students were brought together in a residential place for a few days, and where different sessions took place and they learned from each other. For implementation, of course, we need to train our faculty, and the training should focus on defining what is interprofessional education and discussing the evidence and published literature supporting the concept, describing the roles and responsibilities of healthcare providers in teams and towards patients and family members, communication and work distribution, conflict prevention and management, and leadership and membership expectations. So these are some aspects which should be included while we are developing our faculty before implementation of interprofessional education. This is a conceptual framework which starts with parallel practice, that what we are doing, or to some extent we are at collaboration level, goes to consultation, then the coordination, and final is interprofessional learning and interprofessional practice. Here, different stages from, I showed you this slide earlier as well, from King Abdulaziz University. It starts from the exposure, then it goes to the immersion level, and finally to the development of competencies, of course, over a period of few years. This is Kolb's experimental learning style model or theory, and this can be used to improve our interprofessional education curriculum as well as implementation. That we actively experiment, we plan, trying out what has been learned, and then gaining the experience, and then the reflecting on the experience, and reviewing what are the deficiencies and what are the areas which can be improved, and then again concluding learning and developing. So this experimental learning model can help us to improve our effort for IPE. I think that was the last slide. Thank you very much for your attention, and I would be happy to answer any questions. I have a question here. It's education or skill to improve the patient care. It's both. It's both. When we have this interprofessional education, the different the participants from different disciplines are there, and we can learn from each other. We can see the contribution made by everybody. The next is, where are the subjects that are taught or learned together, and at which step? Basically, the disciplines or professions which they want to implement, they have to work together. And it's the one thing is that it's not necessary to do everything in that way. In one of the university, for example, they have fixed one afternoon in a week where they bring the students from different disciplines in different combinations and expose the students to this concept of interprofessional education. So, right. Any other question?
Can you ask a question, Professor Malay?
Yeah, yes, please.
Yeah, thank you very much for your lucid talk. But I wonder how IPE would differ from multi-professional education, professional education, and trans-professional education. So this is how would it differ from multi and trans-professionals education?
Thank you, Prof. The important words here is learning about, from, and with. The example I gave for multi-professional was, let's say, we want to teach anatomy of head and neck, and we bring the medical students and the dental students. They sit together, they attend the lecture, and then they go away. So there is no learning from each other. There is no learning about each other. So bringing different students from different disciplines and delivering one lecture or few lectures is, you can call it multi-professional. It would not be interprofessional, because as I said, important part of interprofessional is that they need to know each other, they need to discuss with each other, and their role and responsibilities. I think that was a beautiful example given by Dr. Minhas, which I quoted in the study, that the teaching the physiotherapy students and the medical students and how the behaviors changed over time. That is real interprofessional education. Thank you very much for bringing this aspect, because many of us may think that multi-professional is equal to interprofessional education, but the whole purpose is very different.
Thank you.
I hope that address your question.
Yeah, thank you.
Can I just
Yes, Prof. Soso? Yeah.
Yes, I am wondering, Prof, what is the ideal number of disciplines to be included in one course or a module, whatever you want to call it, and also which disciplines to be included in particular course. For example, we pediatricians, we are going to, as you said, the combined clinic for cerebral palsy. Then the disciplines, the students working together during their training course would include certain disciplines, students from certain disciplines like the nurses, the occupational therapists, speech therapists, for example. So these are the choices, also the numbers in a class. So I'm wondering about that. That is for us pediatricians, Prof, like cerebral palsy, but there'll be other examples like your cochlear implant will be the ENT, like that. So there'll be several modules. Is it so, Prof? ASM?
Yeah, I understand, Prof. So your question that there may be too many professions involved in one,
Yes.
and how to bring them together and how many
Yes.
students from each profession. Yeah, I understand your concern.
Yes.
We have to really see the feasibility.
Yes.
And sometimes we might have to repeat the sessions. For example, you are talking about cerebral palsy and we want to have a session. So you may have multiple groups of few students coming from each, let's say some physiotherapy or some other with pediatric students. So
speech therapy and
yeah,
then the
so
nurses, like that.
Yeah, we have to see the feasibility. There's no fixed rule. If it depends all how we can manage that without compromising our teaching commitments and the learning outcomes.
Yes, so it is
so
quite
it can be in different
complicated,
groups.
Prof.
It's not necessarily all of them coming together at one time.
Yes, Prof. So the number and the type of discipline students will be variable, isn't it, Prof?
That's right. That's right. Yeah.
Thank you, Prof.
Yeah. Sorry, just one question, prerequisite for IPP. Yeah, that's important. The students must have some knowledge about their discipline, basic knowledge. So that is why it's more appropriate for if we talk about medical students in clinical years. But it can start in preclinical years with introduction in classes, but actually it has to be in clinical years. So prerequisite is that students must be aware of the basics of their basic subject. Yeah, Prof. Nurjahan from Bangladesh. Yes, please. You are muted, Prof. You have to unmute yourself first.
Yeah, what I feel actually, it has a steps actually. The classroom session, each of the classroom sessions should be followed by a practical session at the work site. I mean, learning by theory is not enough, should be followed immediately after the classroom with a practical demonstration in the clinical site or the work site, whatever you say, so that it is built in with theory and practice together. It should not, I think, if we organize only theory and the practical or implementation later on, so it will create a gap. It may create a gap. So I suggest if we can do the things together, parallelly, or I mean, one after another. One theory, one practical, one theory, one practical, something like that.
I think, Prof, that's interesting idea, but the problem would be the feasibility. So, but if we can manage that logistically, yeah, that would be good. That would be good. But the again, important point I think here is that we should identify the learning outcomes. Which
Yeah.
are the learning outcomes which we want to achieve. It cannot be something that we are doing just bringing the students and teaching them together. That would not serve the purpose. But you are right, theory and more than that would be, that is why I said the workplace
Yeah.
experience is important.
And who is the trainer there? That is also important.
Sorry?
Who is the trainer, facilitator? Someone who has not done it before. I mean the experience
Yeah.
only.
Prof, that's why I mentioned that the training of the facilitator is important. Now,
Yeah.
if medical students are going to attend a speech therapy sessions, then of course the leading role would be the speech therapist, but he or she should be trained how to handle this situation
Kind of TOT.
this situation in
Training
this
of trainer. What do you call it? Training of trainer. TOT.
right. Yeah, training, right. Okay, the next question here I have, sorry, I'll come back to Dr. Dinesh and Aisha Abdullah.
Yeah. Okay.
The next question here is what resources are required? I don't think you need special resources because you are bringing students to a situation or a facility which is already there. For example, medical students going and visiting speech therapists, so there wouldn't be any additional resources. But only thing would be the training of the facilitator. That would be important. So the next is ideal number of disciplines. This, I think Professor has already mentioned. It depends upon how many people and how many professions you can handle at one time. There is no fixed number there. It all depends whether you people can handle. There's another question, whereas whether MOOC platform can be used as long as there is workplace experience, any platform can be used. Yeah, question from Aisha Abdullah.
Assalamu alaikum, sir. It's more of a bit of loud thinking. Sir, regarding IPE, we all those who have been in practice for some years as medical doctors or medical professionals, we understand the importance of IPE. I think nobody can deny that. The way our practice is, at this stage, what we really need to think about is how to weave the thread of IPE in our curriculum, starting from the competency or learning outcomes down to the assessment and certification, and at which level of our institutions who should be the main stakeholder to introduce it. In my opinion, it's the universities who can do it, who have access to different professionals at the institutional level. Employing it with the statutory requirements would not be possible for institutions. Just having it as a dessert in a curriculum, a teacher making it his or her own effort and trying to bring students from different disciplines together in a classroom. We need to think now at a bigger or a higher level about IPE.
I fully agree with you, Dr. Aisha. And I showed you the learning outcomes of National University of Malaysia, where they have changed their learning outcomes to accommodate interprofessional education. It has to be at the university level, at the institution level. It cannot be really implemented on personal basis. So there has to be a change in the thinking. And I'm saying this thing probably the third time, that the issue here is producing capable, skillful doctors and not medical graduates. And that is why all these efforts are being taken Otherwise, we would be producing simply medical graduates with knowledge, and they may or may not be really the doctors we want to see. I got somebody from Oman. Want to share some experience?
Yes, in fact, Professor, thank you very much for your fruitful presentation. We in Oman, is my voice clear?
Yes,
Yeah.
This is Professor Imad.
Yeah, Imad Al-Husami. I'm from Oman. I'm originally Jordanian, but working in Oman for the last 18 years as a consultant in the Ministry of Health of Oman, and mainly in the Higher Institute of Education. So we have the Higher Institute of Health Specialties, and we have created programs, specialized postgraduate programs, and those programs are based on the philosophy of IPE. We bring students from different specialties, medical specialties, of course, health specialties, like, for example, nurses. We have physiotherapists, we have pharmacists, etc. And so they join a full year work where they have projects and where they have clinicals and where they have experience together. So they have a plenty of group work experience within the same academic year.
Right.
They go together to the field, they go to the hospital and share scenarios and solve problems.
Right.
They build up problem-based learning.
Right.
And we are a bit different from the university, where they sit in the class sitting and they just take some courses and they leave, and we talk about IPE. In fact, we really think that what we are doing is really an IPE, because they come together with different opinions about their different roles. By the time they understand each other, and when they exit from the program, they have developed a common understanding of and respect of each and importance of each one's roles. And when they go to the hospital, there they start the culture of interprofessional collaboration. We've been doing this for the last 4 years so far, and the evaluation from the stakeholders is so impressive.
Thank you very much, Professor Imad. I think it's a beautiful experience you have, and very useful experience you have shared with us. But you are doing at postgraduate level, not undergraduate level, is it?
No, it's not an undergraduate. In fact, I'm doing a PhD now, and my PhD is about examining the readiness for IPE in Oman in the primary health care.
Right.
However, I'm doing a mixed design, and I'm using medical and nursing students at one level, and the doctors and nurses at other level, in order to see the level of readiness for IPE, because there is no point that we talk about IPC, interprofessional collaboration, where people are not really prepared and ready for that at the school level.
Yeah, I really hope that this can trickle down to your undergraduate level at some point as well. But we will be waiting for your results and your work. It would be wonderful to share, and hope you will be able to share in this group.
In fact, I would like to thank my supervisor, who's Dr. Suhaila Binti Sani from Malaysia, and we are working together towards achieving this. And I guess once we finish that, we'll share it with you, so that we'll have a broad.
Dr. Imad, you probably would be glad to know that Dr. Suhaila is my colleague.
Oh, I didn't know that. That.
We are working in the same university, in the International Medical School. Yes.
She's really giving me her utmost support, and we hope that we will do that, inshallah.
Oh, it's interesting, right?
Yeah, of course.
Right. There was, I saw one hand raised by Dr. Danish. Is Dr. Danish around? Want to ask some
Assalamu alaikum.
Wa alaikum assalam. Yes.
I wanted to ask a question, but I think Professor Imad Al-Husami has elaborated very nicely over the
Right.
topic. I wanted to talk about the combined training of certain cohorts of medical students, lab technicians, physiotherapists, etc. But once they go to the actual clinical practice, it is not necessary that they work with the same cohort of people, and there has to be an administrative hierarchy in the actual working environment in which somebody has to bear the flag. So I wanted to ask if this can give rise to conflicts while working in the real life environment. But I think Professor Madhul Asami has given quite a bit of light over it. Thank you very much.
All right, thanks. Yeah, any other questions or comments?
Yes, Prof. Alam, if you allow me, this is Mona Sheikh from Saudi Arabia. I just
Please.
would like to share with you our experience since 2011.
Right.
Before I go into our experience, I want to talk about a plan which we are doing for the undergraduate physiology program. I'm a physiologist.
Which university are you?
It is Imam Abdurrahman bin Faisal University from the Dammam, Eastern Province of Saudi Arabia.
Oh, okay.
My name is Mona Sheikh. I'm a physiologist, and I'm the vice president of the Medical Education Society of Medical Education of Saudi Arabia.
Yes, yeah.
Thank you. I'm really blessed with your webinars. I follow them and I attend almost all of them, but I couldn't keep silent today because this is something that is really, I think, touches a deep spot in my heart.
Right.
We are teaching as physiologists, we are teaching 6 colleges in the university, health profession colleges, and we keep repeating the same, lectures with the mild differences according to the course specification of each. So we decided we have a plan of having interprofessional education of physiology, and we are now in the process. And your points that you have mentioned are extremely important. I think interprofessional education is the future. But I want to share with you our experience since 2011. We have published like 4 years ago.
Right.
We have, I think it's a step before interprofessional education. If the faculty learn from each other, like we have 6 health profession colleges, we put them together like 25 candidates. We have a course called HP, or Essential Skills in Health Profession Education, which has 3 modules. And the nurses teach the doctors, the doctors teach the dentists, and it's really has hands-on experience. There is a lot of peer teaching. The 3 modules are about teaching and learning, course design and assessment, and there are assignments in between. So we learned through these 9 years or 10 years of implementation of this program that the faculty have learned how important it is to learn from each other in different disciplines, and they learn the principles. So now, if we want to go into interprofessional education in undergraduate, I think we have to start with the faculty. They have to be like students, put them as guinea pigs, let them learn how important this is.
Right.
They can understand. For example, we learned a few lessons, and I have put that in my article. Nurses are the best people to document. For example, when you go to course reports, they are the best ones who do course reports. And to my astonishment, doctors are the worst, because they have so much, they feel they're magnanimous. They don't need to go and document. They are doing the best kind of, or the highest. So I just wanted to share with you, if you want, I can put my article through in the group.
That would be great. In fact, actually, I was going to request you to share that article in the group. And I know there are some very prominent physiologists among our audience here, and they must have enjoyed your plan and implementation.
And please accept my gratitude, Dr. You are really getting this, getting us all together to discuss very important features. Thank you so much.
That's very kind of you. That's very kind of you. Yeah, any other question or comment? There's one here. Conduct of research is a kind of collaboration, is IPE. Yes, if you see the one of the table I showed, that where we said that the different types of collaborative learning in IPE. Yes, the research projects that in certain university and medical schools, I know that students conduct some research projects, in the group if that group involves students from different disciplines. Then of course that is a very good example of IPE. So let's say it's a medical student with physiotherapy and speech therapist are dental students. Yeah, that absolutely is a good example of IPE. I think we are coming towards the end of the session. I have 2 more slides to share, as I do every time. And the first one is our next webinar would be on 25th of July. And this would be on PBL process, roles and responsibilities. In fact, this would be the continuation of the previous one, which was on PBL package. And there would be some really very useful material which would be shared before this webinar, and that would include a PBL package itself. So inshallah, we will do that. And the last but not the least, our charity drive. May I propose to each participants to donate $1 or equivalent amount in your local currency to any deserving individual in your neighborhood or any public welfare organization. This is the appeal we make after each webinar, and I hope I will get a positive response from all the participants. With that, I thank you everybody for attending this session. I knew this is not a very popular topic, but I thought this is important, and we should be aware of this. And in fact, that is the future, inshallah, that the new generations would be implementing it with a lot of enthusiasm. With that, thank you very much, everybody. Assalamu alaikum.
Thank you very much.
Alaikum assalam wa rahmatullahi wa barakatuh.
Thank you, Prof.
Thank you.
Thank you.
Wa alaikum assalam wa rahmatullahi wa barakatuh, Prof.
Wa alaikum assalam.
Thank you very much, Prof.
Thanks. Thank you, Prof. Soso, for joining.
It's so lovely.
Thanks, Prof.
Thank you very much, Prof. Alam.
Thank you very much, sir. Thank you very
everybody.
much.
Thanks.
Thank you very much.
It's a lovely
May Allah
learning.
bless you.
Thank you very much, Prof.
Thanks. So see you, inshallah, next month.
Yes.